So you can get just started whenever you're ready. Okay.
Okay. Just before I get started, if you guys could tell me kind of what you're in high school, you're in college, where you are in your training.
A lot of us are in high school and college.
High school and college. Is it kind of a mix of high school and college, or?
Yeah, I would definitely say it's like maybe a half and half. Yeah.
Okay.
Yeah.
And have you guys been able to shadow at all before COVID started, or is this kind of getting started like after COVID?
Yeah, I mean, I personally haven't had the chance to shadow in person, which is kind of sad, but trying to.
Yeah, I mean, it's a hard time, but I think things are going to go back to normal by at least the summer. I think you'll see some improvement, and then we'll see how the fall looks. I think there'll be another spike, but we'll see. We'll see. Okay, so I'll get started. My name is Keerthi or Keerthi Shah. I am a GI fellow in Philadelphia at Temple. So a little bit about my training. I went to undergrad at Georgia Institute of Technology. I was a biomedical engineering major and then transitioned into biology. And the way I chose my major at the time is I knew I was interested in going to medical school, but I also wanted to see if there was anything else that interested me, particularly in the field of engineering. So this seemed like something that married both of them. And through the course of my time there, I realized that, after thermodynamics and mechanical engineering classes, that it just wasn't what I was interested in. So I'll go into a little bit more about choosing your major in college and things like that. But then I transitioned to biology and finished up undergrad. Went to medical school at Philadelphia College of Osteopathic Medicine. And after med school, I moved to Philly for residency in internal medicine at Drexel, and then follow that up with fellowship at Temple. And during that time, I actually started my fellowship at Drexel, and due to corporate greed, our hospital was shut down, and there's about 500 or 600 of us that were displaced. So it was a difficult time, and I think this is a difficult time for you guys, kind of going through entering medicine, not being able to rotate through and kind of see what medical life is like, having to make a decision, applying to places without being definitively sure. So just know that this time will pass and you will grow stronger from it, okay? So after fellowship, or during fellowship, I did another fellowship in obesity. So I am interested in obesity and nutrition. And now I'm applying to a nutrition fellowship as well. And I will be attending. Finally, after 10 years of training, will finally get my first medical job. So this is a long, long path. So one of the things I would say is make sure that you enjoy medicine. You're getting into it for the right reasons. It's something that you really want to do. And the best way to do that really is to shadow. So, between now and applying to medical school, it sounds like most of you guys have a lot of years. Make sure that you shadow physicians, get perspectives, talk to as many people as possible. Make sure that this is something that you truly, truly enjoy, because it is a long path, a path that you're dedicated to learning and the whole time. So, in college, at least when you're trying to choose your major, it doesn't really matter what you pick. All colleges want to know is that you did something that you enjoy and you did well in it. So if you want to do economics, if you want to do business, if you want to do international policy, or you want to do biology, all of that is completely fine. Just make sure you do well in your classes, you do the biology prerequisites. If you choose a major that's outside of biology, that's completely fine. You can talk about why you're interested in that particular major that you chose in your personal statement when you apply to medical school. Those of you in college, what is your major right now? You can put it in the chat box if you don't want to say it or anything like that. I don't even know what a chat box is right now. So just say it out loud. Feel free to interrupt me throughout any of this. There's just a few of us here. Your GPA and your MCAT, your scores are really important when you're applying to medical school. Your high school GPA becomes important to getting into college. Your college GPA is important in getting into medical school. So your grades do matter. And your MCAT score, which is different format when I took it, many, many years ago, is the scoring is a little bit different, but the score does matter when you're applying. A lot of colleges or a lot of medical schools have filters in who they take, and there's a number that they'll use, and each college is different. When you're choosing extracurricular activities, you want to stand out with it. Don't try to do as many clubs and activities as you can. Try to do a few things and then excel in them. So whether you become the vice president or president or chair of this, like you guys, Michelle and Abigail, you started this organization, that makes you stand out. This is a very unique thing that you did and that you can talk about in your personal statement, how you're helping other people through COVID and yourselves kind of progress and see if they really like a career. These are the kinds of activities that you should be doing. So it's really good that, you started this organization and you want to continue kind of doing things like that as you go through your training from here to medical school. Research, not as important in high school and to college, but it does become a little bit important in medical school, into college, into med school. What you do necessarily isn't important. It's just that you are active and trying to, learn about the research process, make the connections with different professors in your college, and making those relationships so that you get a really good letter. Okay, so because medical schools know that you're not going to, very few people do outstanding research in their undergrad that it makes a difference on their application. So it's not that you're trying to make something great out of it, that you just want to make good relationships with the people in your college so that you get good letters. The way you find research, honestly, is really just cold emailing or going up to professors. So a little bit about what I did in undergrad. I went to tech, so I did some bench research there. And the way I found my bench research is I looked at all the professors in the biology department, found an area that I thought was interesting, and then emailed them. And in my email, I say, hey, I'm expressing my interest in your field. I would like to get involved in your research. I would like to meet. Send them your CV so they know a little bit more about you and your interests and things like that. And then email as many people as you can. Somebody will get back to you. I also wanted to do some clinical research in undergrad, so I reached out to Emory, which was a more of a medical type of program compared to Georgia Tech, and started working with a few of the doctors in their medical school. And that led to letters. So really all of this is that you make good connections so people can see how good your work ethic is and write you a good letter. Personal statement. I get a lot of questions about personal statements, what you should write about, what topics are good. Essentially, you want to write something that's well written, so good grammar, good structure, and then it flows well and explains why you're interested in going to medical school. That's all that's important in your personal statement. The way you write it, it can be really, personal to you. It doesn't matter what you write. There isn't a specific topic that makes medical schools not interested or that makes medical schools say, no, not this person. Really, that what matters is that you write a well thought out essay that flows and explains why you want to go into medicine. Mine was about, I used to be a dancer, so mine was about relating dance to medicine and the art of storytelling and, putting together a story and kind of coming up with solutions and things like that. And if you guys have any specific questions about any of these things, obviously feel free to email me. Like I said, letters of recommendation are also very important. You want strong letters. So when you're asking people, make sure it's people you've made a good relationship with. You want to provide them your personal statement. You want to provide them with your resume and ask them if they're able to write you a strong letter of recommendation. I have a friend who was applying to medical school and had a letter with a letter writer addressed them with the wrong pronoun. It was a girl that was applying and it was him all through the letter of recommendation, which shows that this professor just copy pasted from somebody else. It wasn't a very personal letter. And that doesn't look good when you're applying to medical schools. So that's what I would do for letters. And it kind of goes the same way when you're applying to colleges as well, kind of all of these tips. And then shadowing becomes important. It becomes important because people want to see that you are really interested in medicine. You're choosing to go into this because you did your research and you enjoy medicine. So that's why shadowing becomes important, to let them know that you worked in various fields and you liked what you saw. You liked working with patients. You enjoyed making people feel better, whatever that might be. Do you guys have any questions so far?
I have a quick question. Do you have any suggestions about when COVID passes and we can go shadowing in person again? Do you know like how we can get the most opportunities for shadowing?
Yeah, so what I did, and I know that still exists out there, is hospitals have shadowing opportunities. And so essentially what you'll do is you'll apply through your local hospital, put in an application, say, hey, I'm interested in shadowing, and they'll set you up through a shadowing program. And you'll go through various specialties. The other thing that you can do is reach out to your local physician. So any specific field that you're interested in. So I applied through the hospital system, but I wanted to see specific people in the clinic section, not just in the hospitals. So I reached out to a few clinics, just cold emailed them or called their office manager from their number through the internet. So that's what I did. I think the hospital way, you're able to go through multiple specialties, but that's what I would recommend. Once you get into undergrad, your college will actually have shadowing opportunities set up through their local hospitals. So that will be helpful. That's a good question, though. I do foresee in the next maybe in the next couple months, that you guys might be able to start doing that again as vaccines become more available. Have you guys been able to sign up to get a vaccine? You guys are in high school, so probably not. I guess
Not yet.
Yeah. Realizing you guys are probably younger than 18 years old. So, okay. So this is far, far, far down the road. I wouldn't even think about this right now unless you're in college and applying soon. But there are other pathways to medicine. If you applied to medical school, you didn't get in, or you're extra nervous and you want to have other opportunities, there are other things that you can do. So one such opportunity is a DO school, so something called Doctor of Osteopathy. This is what I am. So 11% of the physician workforce are DOs. Essentially, it's very similar to MD. You go to the same medical school curriculum, similar board certifications. The only difference is you do an additional training in osteopathic manipulative medicine. And what that really is hands-on therapy to diagnose, treat, and prevent illness and injury. So I'm going to go through just a few examples. So this first picture you see here is one of the most common complaints that patients will come into the office, to any office with, is aches and pains and groans. So they'll say, my back hurts, my arms hurt, I have a headache. So a lot of the techniques of OMM are to relieve muscle pain. So this is one such technique where you see something called high velocity, low amplitude technique. You can think of this as if you crack your neck, that's that type of technique. And so this people will do to all parts of their back, and it helps relieve muscle strain and sprain. So there's various techniques. There's also techniques to help with other issues that people might have, like constipation. This one will relieve constipation. So these are some additional tools that you'll learn if you go to osteopathic schools. And if you're interested, that's another person to shadow to see if that's something you enjoy. The other pathways to medicine are foreign medical schools. I'm not going to go too much into that now. And then there's post-bac pre-medical programs. So this is something after you finish undergrad. If there's a specific area of your application you need to work on, like your GPA, your MCAT scores, et cetera, you apply to this one-year program. It kind of helps shape your application and make it better. And some of these programs are feeders. So if you do well in their one-year program, you kind of automatically, based on your GPA and your MCAT score, will roll over into their medical school. So I linked, this link will kind of show you all the list of the programs that exist right now. Another thing I didn't put on here because this is more for college students, but if you're in high school and you're applying, one of the things you can look into is a 6, 7, 8-year medical school programs. My husband went to one of those programs and he highly recommends it. So essentially you do a certain number of years of undergrad. If you maintain a certain GPA and you get some base level MCAT score, it doesn't have to be as high usually as other programs, then you'll automatically roll into their medical school. And so you do have to do pretty well in high school to get into one of these programs, but it will kind of set you up for medical school. A lot of these programs are in the Northeast. I think there's a couple that have opened up since then in the South. But since you guys are located in New York, it's definitely something to look into. So my pathway in GI, I went to 4 years of high school, 4 years of college, 4 years of med school, 3 years of internal medicine, 3 years of GI, and then my obesity and nutrition training is additional to this. So what we do, once you get into any subspecialty these days, there's many other further subspecializations you can do. So in GI, there's hepatology where you learn about the liver, advanced GI where you do all of these very cool GI procedures that I'll talk you through in a little bit. Motility, which works on how the GI tract moves. So these doctors specialize in people that have difficulty with moving things through their GI tract. Inflammatory bowel disease, which is special disorder, 2 disorders where you have your body kind of attacks your GI system, nutrition and obesity. So why did I go into GI? So for me, I think why anybody goes into their specialty is the experiences that they have, the people they work with, their mentors, and the specific experience you have during your rotations and while you're shadowing. So when I went through that process, I really enjoyed my GI rotation, essentially because you're working with your hands, you're doing a lot of procedures, and I'll go into those procedures, but you're also working with patients, you're developing patient relationships, you follow patients through a long period of time. And you get instant gratification. There's very few areas of medicine where you can go in and fix something without a medication and the patient feels good going forward. So we work with a lot of GI bleeding. So, we go in, we treat a bleed, and then the patient is fine and can go home. We work with a lot of organs. So everything from the mouth to the butt and the digestive organs outside of your actual luminal gut. And we do a lot of we're in the forefront of innovation. So there's a lot of techniques that we're doing now through our GI system. Instead of cutting people open, it's less invasive. And so it's very interesting the direction that GI is going in. So here you see we work from the mouth, the esophagus, the stomach, the small intestines, the large intestines, the rectum. We also work with the liver, the gallbladder, the pancreas, and the biliary tract. And the biliary tract essentially is a drainage system for our liver and our gallbladder. We also treat obesity. So previously, if you wanted to treat obesity through procedures, you had to go through a surgeon who cut you open and did surgery. Now we can do a lot of that techniques through your mouth. So we go in with a camera into your mouth, into your stomach, and we have various tools where we can treat obesity without cutting you open. So it's less invasive. And this is another way that we treat obesity. We put in balloons into your stomach that make you feel full, and you eat less because of it, and you lose weight. We also treat GI bleeding. So, and we'll go through a case for this later, but essentially for many reasons, people will bleed in their GI tract. And the bleeds can be pretty significant and lead to death. So we go in with a camera and we find the bleeds and we treat them. We also are the forefront of managing colon cancer. So as you know, we screen patients for colon cancer after the age of 45 or 50. We look through their entire colon. So we find colon cancers, and sometimes we can actually resect colon cancer through our less invasive methods without having them going to surgery and cutting them open. We do special tests called capsule endoscopy. So if you're bleeding in your small intestine, or we can't easily get to it with a camera test, this is a little pill you swallow, and it takes 10,000 pictures through your small intestines and lets us know what's going on in there. And then we'll go in with special tools after that to find out. We do ultrasounds, internal ultrasounds, where we can find cancers that are outside of your GI, outside of your colon and small intestine. So here you see there's a tumor in your pancreas. We do another special technique called an ERCP. And what that does is it goes into this bile tree and helps, again, diagnose cancers, take out gallstones, take out pancreatic stones. It helps us put in stents in if there's narrowing. We also work with motility. Like I said, we do special tests to diagnose reflux, to diagnose issues with the movement of any part of the GI tract we talked about. We help people eat. For patients that can't eat through their mouth, we put in a special tube into their stomach, and then we feed them through the stomach. So there's a lot of things that GI doctors do. So I'm a GI fellow, so I'm in my last year of training, and this is kind of what my day-to-day looks like. So, you know, I get to work probably around 6. If I'm on consults working in the hospital, I'll see new patients that have been admitted overnight. I will see the follow-up patients that have already been in the hospital that we're following. I'll determine who needs a procedure. And then in the afternoon, we start doing procedures. There's endoscopy where we go in with a camera into the mouth. And then a colonoscopy where we go with the camera up your bottom, or other procedures that I talked to you about. We also work in the clinics. So that's the usual 7:30 to 5. We see patients who have routine issues like constipation, heartburn, belly pain, various complaints like that. We do research on various topics. I do teach medical students, residents, and lower year fellows. I'm also interested in social media education, so I'm active on that, and I do enjoy writing. So I do write for our local newspaper. So I do want to go over a few cases. Now, this isn't for you to learn GI, but just to see kind of what we do and to see if you're interested. It is interactive, so if anybody wants to talk and I can ask questions through it. So our first case is a 50-year-old female, has a medical history of osteoarthritis, so that's joint pains, and is on a medication called ibuprofen, which is like Advil, Aleve. They're your over-the-counter pain medication. They're coming into the hospital, and they have black stools, black tarry stools, like the picture on your left. They're lightheaded, they're dizzy. So usually when patients come like this to the hospital, the ER will evaluate them. Okay, they'll check their vitals, and you see that the heart rate is 110. And that means that they're tachycardic, their heart is racing, okay? And their blood pressure is 90/60. So that's a lower blood pressure, they're hypotensive. You get lab tests done, so you draw their blood, you send it in, and you see their blood count is low. The hemoglobin is 6.8. Our usual blood count is anywhere between 13 to 15. And they check their iron study, so iron is low. And what that tells us is this person is losing blood. You do a rectal exam because it's so important in GI. We do a lot of butt examinations. You take your finger, you put it right up the bottom, and you look at the stool. Okay, you look at their poop. And their poop tells you a lot. Okay, the color of the poop lets you know where someone is bleeding from. So someone has black, tarry stools. It lets you know that it's an upper GI bleed. That means it's coming somewhere from the mouth to the small intestine. Usually, there's exceptions to every rule. And if it's bright red blood that's coming out of your bottom, it's usually from your lower GI tract. Usually it's from the colon. Okay. So this person has black stool. So this tells you it's something from the top. And the reason that becomes important because we need to know when someone is really sick where to put a camera and look. And it becomes a very time-sensitive issue because people can bleed out very quickly. So We, have to treat this person with supportive care. We put them in the ICU. We give them IV fluids through their vein. We give them blood products. And we start a special medication that's going to help them form a clot. We stop the medication like ibuprofen, and I'll go into why in a little bit. And we go in with the camera and we do an endoscopy. So we're going through the mouth, through the esophagus, into the stomach. And we see this here on the left. And what you're seeing here is this is an ulcer. Okay, it's almost like a scar. It's like if someone nicked you in your arm and you hit a blood vessel. And this blood vessel is an artery and it's spurting blood. So usually when you see this, it can cause some fear, right? Because this blood is going to quickly fill up the stomach. You're not going to be able to see where the blood is coming from. And it's going to get pretty hard to treat somebody. So it is cause for concern. Now, when you see this, we have various ways of treating it in GI. We can inject a special medication that temporarily stops the bleeding so we have a better view. We can burn the blood vessel. We can clip the blood vessel, or we can put a rubber band around the blood vessel. All of this to stop the bleeding, okay? And that, after we do that, the bleeding will stop and the patient will feel better. And the reason a lot of patients bleed like this, the most common causes is there's two. One is from a bacteria that is very common in all populations, but specifically in Asia and South America. And the second one is over-the-counter medications like Advil, ibuprofen, Motrin, Aleve. They are our enemy. We absolutely do not like them. We don't like it when people take them long-term. So it's something to take away from this talk. When you go home, check your parents' medicine cabinet, you'll see there's a lot of these medications. And because they're over-the-counter, people think that they're healthy, but they are not. If you guys have any questions about this case, just let me know. Just chime right in, okay? The next case I'm going to go through is a 25-year-old comes in for schizophrenia, which is a psychiatric disorder. And they come in with difficulty swallowing and pain on swallowing. So that's what dysphagia and adynophagia is. And you get an x-ray, so you scan them, and you see there's a metal tip and a plastic casing in their stomach. Okay, so this is kind of what you're seeing. This is a plastic casing. There's some metal things that you're seeing. And essentially what this person did is they swallowed razor blades, okay? So what do you do when that happens? You have to go in and retrieve those objects. So you want to protect their airway so that when you're grabbing it, it doesn't fall into their lungs. And you're going to go in with that camera test again. And you're going to go retrieve it. So some of the crazy things I've taken out: belt buckles, people's glasses, razor blades. There used to be this guy that would swallow razor blades as a bar trick for money. And he would come in every couple of nights with tons of razor blades, and we'd spend from 2 a.m. to 3 a.m. just fishing them out. So you will definitely see a lot of that if you go into medicine, people sticking things up where they shouldn't be. And the last case I'm going to talk about is something that we deal with very often. It's a 60-year-old male, no past medical history. He's coming in with weight loss, bleeding from his bottom, so bright red blood in his poop, and constipation. They check their blood counts, and hemoglobin, again, is 7.1, so that's low. His iron's low. You do a rectal exam because you know how important that finger to butt test is. And you see that there's brown stool, okay? You do a camera test, but this time through the bottom, and you go into their colon, and you see that this person has this nasty looking bleeding growth. It's cancer. So as a gastroenterologist, one of the most important services we provide is we screen people routinely for colon cancer. Okay, so anyone over the African Americans over the age of 45 and all other people over the age of 50 get a colonoscopy. If your parents haven't gotten it, I would urge you to make sure that they get one done, because colon cancer is asymptomatic. So there's no symptoms until it's bad, okay? So you want to make sure that people get routine testing so that you can prevent them from ever getting colon cancer. And we screen people every, based on what we find every certain number of years. Okay. That's really about it. I think you guys are entering medicine in a very, very great time because social media allows you to connect and talk to people. So I would encourage you to reach out to as many people as possible on social media, talk to them, message them, ask them for advice. You can never have too much advice when it comes to this process. When I was going through it, I would cold email people, I would guess their emails and email them for advice. But now you're able to just get to people much easier. So take advantage of that. And the other advice that I would say is, you reach out to someone, they don't get back to you. So don't feel bad about sending another email. Be polite and persistent without being annoying, so no one is going to feel bad if you or get mad at you if you send another email. Feel free to reach out to me. This is my information if you have any further questions. You guys have any questions?
So I had a quick question about the patient who swallowed razor blades. Like,
Yeah.
if the patient swallows razor blades, what kind of damage is done, and how do you fix
Yeah. Yeah, so razor blade, anything that's sharp, we always go in and retrieve because it will nick the surface of your, essentially like if you take a razor blade and did this, you would get a superficial cut. So that's what would happen to the inside of your GI tract. You would get tons of superficial cuts. If by chance you hit a blood vessel, you would bleed significantly. Okay. The other thing that could happen is something we call perforation. So if it's sharp enough, it will go through your GI tract and make a hole. You don't want that because things in your GI tract will leak outside into your body. And the stuff we have in our GI tract is important for digestion. So if it leaks out to where it shouldn't be, it will digest things that it shouldn't and cause a lot of havoc. So you don't want that to happen. So what we do is we go in as quickly as possible. We have special tools that prevent that make sure that when we're taking it out, that it doesn't injure any other part of your GI tract. And usually the superficial cuts and bruises will heal on their own. If we see something deeper, then we'll treat it again by burning it, clipping it. If we see a hole, we have special tools that kind of close up holes. And if the hole is bad enough, you might have to go to surgery. But usually it's something that we can take care of.
I have a question, not about the case, but I was just wondering if there was like anything that you wish you knew before going into medicine or like your specialty.
Yeah, so one of the things I wish I knew is to take the time in high school and college to enjoy your life outside of applications and getting through this process because it's a very stressful process. And oftentimes, at least when I was going through it, I didn't know anybody else that was going into medicine. I was stressed out and I was constantly working on stuff. And I enjoyed my life as much as I could, but I wish I had realized how, every step of this, there's more and more responsibility and more work. And you have to remember to enjoy the moment. So take the time right now in high school and college to really enjoy your time. This time will not come back. And as busy as you think you are, it will only get worse. So you'll only get better. And of course, you're going to enjoy what you're doing. You're going to take time for yourself, but enjoy the moment. Enjoy where you are right now. The other thing I would say is remembering that, take time to do the opportunities that you enjoy rather than what you think will look good on your application. Because if you truly enjoy something, you'll excel in it and it will become something that you can put on your application. I know those are not really things that they're really abstract things, but I would highly recommend that you take the time every day and do something fun for yourself.
There's actually a question in the chat.
Oh, let me see. Do you have any tips on what to do for high school? I would say when you're, high school into college, there's really not a whole lot of things that you would do in high school that are going to help with med school. It's more so building your resume to get into undergrad. And so, you're working on your GPA activities that are going to get you into a good undergraduate school. But other than that, not a whole lot different. You're still going to make sure you're doing activities that make you stand out. You're still going to make sure you do well in your high school classes to get a good GPA. You want to make sure that when you're writing your personal statement, it's well thought out, it's well written. The one thing that I, again, would say you can look into in high school is if you know 100% that you want to go into medical school, you can look into those 6, 7, 8-year programs. The other thing I would say is when you're doing AP classes, that's something that, will make you stand out, and you can skip those classes when you get to college and kind of take the next level. But really, I would say that's about it. Everything else is pretty similar, getting into med school from undergrad versus getting into undergrad from high school. Are there any changes to your lifestyle that made after you started studying? Were there any changes to your lifestyle that you made after studying? Yes. Maybe not so gastroenterology, but going through undergrad and really medical school, you don't realize how little education you get in nutrition. There's almost nothing. You might get a day of nutrition in medical school. You don't get any in residency. And then if you go into GI, you can do an optional 2-week rotation. So very little education. And you would think that going into medicine, and because a lot of the diseases that we get is related to our lifestyle choices, that we would have more education in this. So that's kind of why I decided to go into obesity and nutrition. I think you'll find once you start living alone, initially you make a lot of poor dietary choices when you're in college, and that's okay. That's just kind of the nature of how busy your life is, and your food becomes the least important thing. But once you start medical school and residency, even honestly, you're busy in medical school residency. Oftentimes, you're just eating whatever they have for you in the hospital. So you do make a lot of maybe unhealthy choices. You have to really think about making good choices, and it's hard when you're that busy. I will say that I think my biggest change I made was probably once I started fellowship, and I had a little bit more time for myself to start cooking more and grocery shopping, a little bit healthier choices. I think that's when I made the most of a lifestyle change. And what changes I made, I would say, switch eating less processed food, right? Because I think the biggest issue with our diet today is processed foods, red meats, processed meats, and high fat dairy, and of course, alcohol, smoking, things like that. So for me, the biggest thing that I cut out was processed foods, mostly. Daily schedule in medical school. That's a good question. So there's the medical school is first 2 years, you're just in school the whole time. You're in classes the whole time. So you're in 8 to 4, 8 to 5. You're doing classes all day long. They record the classes. Attendance is not mandatory. So some people will choose to just listen to the classes online at home and take notes. You'll take step 1 at the end of medical school, at the end of your second year. There's a recent change made to your step 1, so it's no longer a score-based, it's pass or fail. Once you take that, you start rotations in your third year. So then your schedule changes. Life becomes so much more exciting because you're in the clinic, you're in the hospital, you're seeing patients. Your schedule is really dependent on what rotation you're on. So if you're on outpatient rotations, it's 7:30 to 5. With a lunch break, you'll see patients with the physician. You're kind of like a fly on the wall. They'll ask you questions, you'll study, and at the end of each month, you'll take an exam. If you're in the hospital setting, again, your schedule is really dependent on what you're on. When you're on internal medicine, again, it'll be probably 7 to 5 is your average day. You'll get in early, you'll see your new patients. Then you'll present on rounds. So rounds is when the attending, everybody, the whole team gets together. You discuss all the patients, you see all the patients. And when you're discussing, one person will present the patient. They'll say, similar to how I presented the case to you guys, is a 50-year-old female, past medical history of this. They came in with this. This is what they're saying. This is what I think we should do. Kind of that you'll present your patients. And then in the afternoon, you'll wait for new patients to come in through the emergency room for new admissions. If you do surgery, your hours are a little bit longer. Your days will start earlier. Your days may end later. You're in the OR, your operating room, kind of seeing cases. So it's really depends on what rotation you're on. But in general, the first 2 years are kind of structured, sitting, learning, studying. You will go crazy in this first 2 years with how much you're staring at a book. And the next 2 years, you're seeing patients, taking exams. It's a lot more interesting, I would say.
What would you say are the most, like, I guess, important or, yeah, I guess important characteristics of being a doctor?
Yeah, I would say empathy and humility are probably the most important things. It's not even knowledge. You know, the knowledge will always come. There's always going to be things you don't know. It's so important to admit to patients and yourself when you don't know something and where to get help from, right? Because as medicine doctors, always going to be things that you don't know. And there's a subspecialist that focuses on that topic. So you can say, hey, I don't know how to treat this. I'm going to send you to this person, as opposed to trying to do everything on your own and having something happen. The other thing is empathy, right? Patients are sick, they're upset, they're coming to you for a particular reason, and they just want to know that you care. And sometimes all they need to know is that you care. All they need to know is that there's someone to listen to them when things aren't going the right way. Rather than always providing a solution. So I think those are really important characteristics. Most people think knowledge is so important when you're going to medical school and becoming a doctor, but there's always going to be things that you don't know, and that's okay. We have resources to fill those gaps, and there's other people that specialize in specific topics that can help you out. So I would say it's humility and empathy.
So I had another question. So like you mentioned before, there's a lot of material you have to learn for medical
Yeah.
school. And so my question was, are there any effective study
Yeah.
habits or tips that you have for people who are studying
Yes.
like a lot of material?
Yeah. I would say the most important thing, and it took me a long time to realize this, is how do you process information the best? That is something you have to figure out when you're in high school and college. Do flashcards work for you? Are you more of someone that just does questions and then you take notes on the questions? Are you someone that has to take notes and just review your notes over and over? So understanding how you study and how to become for you to learn the material quickly, that's a skill that is very important that you learn early on. So for me, what works is flashcards and repetition. So I knew that, and every material that we'd have, I'd have a stack of flashcards and I would review them constantly. So that's what worked for me to get through med school, because the example people use is it's like opening a hose all the way and standing in front of it and trying to swallow all that water. That is what medical school is like. It is trying to process an enormous amount of information in a very short period of time. It's hard, it's hard. There's no going about it. But if you know how best you learn information, that's going to prepare you the most for medical school. It's a lot of memorizing. So knowing how to memorize is also important. So for me, it was flashcards. But for some people, it's just going through questions and repeating different questions over and over again. And for some people, it's just taking notes and reviewing their notes. Able to continue.
And I'm sorry, I had another question.
Yes,
So
go
what
ahead.
are some of the greatest challenges that you face during medical school or being a doctor now?
Medical school, for me, it was keeping a balance between, being in school and maintaining and kind of doing anything else, because it does get overwhelming. You just are sitting all day and studying. And I think it's so important that if you don't learn how to keep balance, that it really will affect your health. You know what I mean? Because you'll be studying all day long. So it's so important to make sure that you take breaks, you do something for yourself, you take care of yourself, you exercise, you eat well. All of that is so important when you're going through this process. You don't want to forget about taking care of yourself, because there's a lot of burnout in medicine. People are so busy taking care of others that they forget to take care of themselves. And there's high physician suicide rate. There's high retirement rate in physicians. A lot of people will go into other areas outside of patient care because it just gets to be so overwhelming. I'm sorry, what was your, I just want to make sure I answered your question.
Oh yeah, during medical school, and are there any challenges in like
Challenges,
being
yeah. Yeah, I would say it's making sure that you take care of yourself because there's a lot. And when you become a doctor, there's so much that you have to do for patients outside of just seeing the patient. A lot of administrative work, a lot of politics behind it, insurance things. So all of that kind of takes you away from patient care, and that's what contributes to burnout as well. So I think those are all kind of challenges to medicine that I don't think we're going to solve anytime soon. And so kind of through that process, it's important to keep sane by making sure you're taking care of yourself. Someone asks, were you able to continue with previous extracurricular activities while in medical school and residency? No, I was not. The one thing I did continue is I do enjoy medical writing. So I did continue that in residency. And I did do, some dancing, which I had done kind of my whole life in medical school, but overall a lot less than I was doing before. Yeah, you'll have to prioritize a couple things, sleep, self-care, and then extracurriculars, So for me, when I wasn't studying, it was being social. I had to get out, see people, do activities outside. And so that's kind of what I did when I was in medical school and residency. I tried to get out as much as I can and do as much as I can. So I didn't do a lot of extracurriculars. I did continue medical writing as much as I could, but not as much as before. Yeah, that's a good question, though. I mean, I think that if it's something that you truly enjoy, for example, you truly enjoy playing tennis, then that's something that you're going to prioritize as your self-care and continue to do that in medical school and residency. So it really comes down to your priorities and what keeps you sane. Yeah, of course, Brooke.
I'm sorry. Okay, I have
No,
an.
that's okay.
So
Absolutely.
how often are you seeing patients versus like performing procedures?
Yeah, that's a good question. So as a fellow, it is I do 4 months of procedure time dedicated to procedures in a year. And the other, I would say another 4 months dedicated to seeing patients. And when I'm seeing patients, if they need certain procedures, I will still do procedures during that time. When I become an attending, it's 50-50. Half my time is spent doing procedures, half my time is spent seeing patients. If you go into other areas of medicine, you won't have to do procedures. You'll spend more of your time seeing patients. My husband's an endocrine fellow, 100% he'll be doing patient care only, no procedures. Yeah, so that's a good question. It really depends on if that's something you enjoy doing procedures. Then when you go to pick your subspecialty, you'll pick something where there's procedures. And usually most of those fields are 50-50 unless you're in surgery. If you go into a surgical subspecialty, that's where you'll do more procedures than maybe routine patient care. That's a good question. Any more questions? If you guys think of anything else, feel free to contact me at my email address and Instagram. Again, if I don't respond the first time, just feel free to message again. I will not get upset. It will be a good reminder for me.
All right, thank you so much for coming and answering all the questions. And your PowerPoint was really informational as well. So that was great.
I'm glad to hear it. Thank you guys for having me. Take care. And of course, let me know if you have any other questions. Okay.
Thank you. Have a nice day.
You too.